I want to take a little time to talk about medical mistrust in the context of the new COVID-19 vaccines being rolled out all around the country. Medical mistrust is absolutely valid, but who do you trust? It's been difficult for a lot of folks to have any trust in the vaccine development process because of the politics and the suspected political influence over the scientific processes. And the radiologist who was promoting herd immunity from the White House was making it sound like some sort of planned genocide in our communities. It's hard to say, ignore the ignorance you see on TV. Pay no attention to that man behind the curtain. He's a fake. She's a fraud. Don't trust them. But who do you trust? The U.S. Public Health Service deployed to respond to COVID this year is the same U.S. Public Health Service that conducted the Tuskegee syphilis study that started before my parents were born and didn't end until after I was born. So it's not ancient history. But that was a study where known effective treatment was withheld from Black men with syphilis to see what the effects of the disease would have on them as it progressed. And Black nurses were used in that effort. So rolling out some Black folks to vouch for the vaccine on TV isn't necessarily going to address everyone's concerns. But today we have oversight like institutional review boards and community advisory boards as a result of what happened in Tuskegee. But medical mistrust isn't just about the past. Many of us, like Dr. Susan Moore, whose story you may have read about this week, have direct experience with medical abuse or discrimination or racism in healthcare settings up to this day. So it may not be in your nature to trust the healthcare system. But who do you trust? For me, I trust a lot of the folks I've been working with for the last 10 years since I've been learning and talking about biomedical HIV prevention research. Researchers, including Tony Fauci, have been working on an HIV vaccine for decades. And we're not close enough to think that we could have a product ready for approval in another year's time. But we already have a couple of vaccines for COVID-19. Now, I knew this thing was a big deal in February after a meeting in DC when I got a briefing from some folks at the State Department on this new disease so that we could start adjusting our plans for the International AIDS Conference in July. And then all of my research colleagues got pulled from their HIV work to start working on COVID-19. Then I got to Boston for the annual conference on retroviruses and opportunistic infections that first week in March, and immediately got an email that the meeting was canceled because so many of the scheduled presenters had to stay in their home countries to respond to this new global pandemic. So how do we have a COVID-19 vaccine so fast? Because before there was an Operation Warp Speed, folks were already on it. Because COVID-19 or SARS-CoV-2 is not a totally new virus, folks have been working on coronaviruses since SARS and MERS years ago. So there's already some understanding of other forms of the virus. The studies have moved through the clinical trial phases faster than normal, sometimes overlapping to save time, but not cutting any corners with regard to safety. And they've recruited more people than normal in the phase 3 studies so that they could get results faster. The result is that we have a lot of data from the ongoing COVID-19 vaccine studies, but there's still a lot that we have to learn. We know that the vaccines that have already been given emergency use authorization by the FDA are generally safe and effective. You know, you won't grow an elbow on your forehead if you get vaccinated. COVID might kill you, the vaccine won't. About 10% of study participants in at least the Moderna study have been Black folks, so we know that it works for us. We don't know how long the vaccines provide protection, and we don't know if the COVID-19 vaccines prevent infection, only that they prevent severe disease. If a person can be vaccinated but still be infected, they can still transmit the virus. So until we know if the vaccines prevent actual infection or transmission, then masks and social distancing are still needed to stop the spread. So what are you supposed to do? Just like with HIV, you need to first understand your risk of exposure. Do you have to go to work every day or can you work from home? Do you live with folks who are out getting exposed while you isolate? If I had to go to work at a healthcare facility or a school, grocery store, gym, bar, or nightclub, I probably want to be vaccinated as soon as possible because my risk of exposure in those places is pretty high. Or if I was over 75 years old, I'd want to get vaccinated because the risk of severe disease is pretty high. And the vaccines are 95% effective at preventing severe disease from COVID. And remember, COVID can kill you. So me, myself personally, if I were in one of those high risk categories, I think the benefits of being vaccinated outweigh the risks of not getting vaccinated and getting COVID, which could kill me. Now, if you're like me and Auntie Dionne Warwick and you don't mind staying isolated for a while, you probably don't mind waiting your turn. Waiting does not mean never. If you want outside to reopen and things to get back to normal so that you can go to concerts and travel and gather together in the sanctuary for worship, you're going to want as many people as possible to be vaccinated. The deal is that unless you are in a high risk category, you're not going to be offered a vaccine anytime soon. So keep calm. As the research studies continue and more of our essential workers and elders get vaccinated in this first round, the already established safety and efficacy of these vaccines will become more and more clear to everyone. Until then, stay informed so that you can make the right decisions at the right time for you and your family. Stay safe by wearing masks and social distancing, and get some more knowledge about it by visiting preventcovid.org for the latest from the NIH-funded COVID-19 prevention network that I work with. And listen to experts that you can trust.